Good morning. 2 years ago, when I took office, I knew this position would bring with it many challenges, but none of us could have known about the looming pandemic. However, as a medical doctor, I knew that its arrival would be swift and dangerous. I'm proud of our response to this pandemic. The actions by our Department of Public Health has saved lives. Public health experts and nationally recognized doctors and scientists and our hospital systems coming together to fight this pandemic has proven to be an invaluable partnership. I've had countless conversations with medical professionals about the pandemic, and as a new virus, it required all hands on deck and quick decisions had to be made, including putting in place one of the first mask mandates in the country. In the hospital where I've worked a few shifts a month during this pandemic, I saw the impact of this deadly virus. It has affected us all. Now, with more and more people getting vaccinated each day, we're able to relax restrictions and move about a bit more freely. But we still need more shots in arms. Today, I want to discuss two concrete ways that St. Louis County is bringing COVID-19 vaccines into neighborhoods, making it easier than ever to get your shot. As I've discussed before, the county's Department of Public Health is forging partnerships with community organizations to put on targeted vaccination events in neighborhoods across the county. Places of worship, businesses, labor unions, community groups, and other organizations are partnering with the Department of Public Health to provide vaccinations for their members and followers. We've already put on several such vaccination events, and many more are planned. And we want to build on these efforts. By partnering with the community organizations like these, we are leveraging the level of trust they have already earned, and we are making it more convenient for individuals to get vaccinated. If you're a leader or member of a community organization, business, or nonprofit agency, consider this your invitation to partner with us on a vaccination event. We are looking for any group that can provide adequate space and can recruit individuals to get vaccinated. You do that, and we'll bring the vaccine and the vaccinators. To apply or learn more, visit stlcorona.com and click on the Vaccination Partnerships button. Secondly, some weeks ago, I announced our partnership with area fire districts to bring vaccinations into the homes of our homebound residents. Today, I'm proud to announce that we have vaccinated about 550 homebound residents and their caretakers under this program. And the best news is this: we're looking for more homebound individuals to serve. We use the definition of homebound from the Centers for Medicare and Medicaid Services. We believe that there may be more than 1,000 individuals in our county who meet this definition. If you are limited to your home and want a vaccine or know someone in that condition who does, please email us at dphcovidvaccine@stlouisco.com or call 314-615-2660. These are just a couple of the many ways we continue to make it easier than ever to get vaccinated. If you have not yet been vaccinated, please visit stlcorona.com, where you will find a full list of all of our vaccination events. Many of them require no appointment. But if you would prefer to schedule your vaccination, just click on the appointments box and select the day, time, and location you prefer. Remember, getting vaccinated is the single most important thing you can do to get back to normal. And remember, continue to wear masks, avoid crowds, and wash your hands. If we all do our part, we can reopen STL. Thanks, and I'd be glad to answer any questions.
Dr. Page, we have a question from Channel 2. What makes the vaccination partnerships with churches and businesses so important? Is it critical because fewer people are going to the mass vaccination sites?
So the question from Channel 2 is about why these partnerships in the community for vaccinations are so important. We are having the same challenge as everywhere in our country, that we have worked through the folks that were eager to get vaccines, and now we're dealing with vaccine hesitancy. And we need to get a greater vaccination rate in our country, in our community, to fully reopen our economy and get back to normal. We know that these partnerships are important. They exist in groups that have trusted relationships. This hesitancy is very important to recognize, and we understand that when people see other folks in their groups or organizations, social groups, churches getting vaccinated, then they're more comfortable getting vaccinated as well. When they see someone else have a good experience, then they're more comfortable in the vaccine. And there's certainly a convenience factor as well to be able to go to a place that you're familiar with.
And from public radio, we have a question. The FDA is expected to approve the Pfizer vaccine for adolescents ages 12 to 15 by next week. What plans does St. Louis County Department of Public Health have for expanding its vaccine access to this group?
So the question from public radio is about vaccines for 12 to 15-year-olds. The CDC is expected to approve this age group for vaccination any day, and when they do, then St. Louis County Department of Public Health will be ready to offer vaccinations to that age group through our normal vaccination locations at our public health sites, county sites, or through our partnerships in the community. So the same process will be in place as it has been for everyone else who's been vaccinated. Go to stlcorona.com, click on the vaccination tab, and look for a location that's convenient for you. There will be some logistical issues about consent, parental consent. There'll be some challenges around identifying proper age groups. We'll work through all of those following whatever guidelines that the state and the CDC establish. We'll follow those protocols and procedures.
And do you see those, that working with school groups or school districts is a part of getting that group vaccinated?
Yeah, so the question is about partnerships with schools for vaccinations of teenagers. We'll certainly work through our Department of Public Health and work with our schools as we have from the beginning on vaccines if it's determined through schools and through our Department of Public Health that using a school site for vaccinations is the right path forward. Then we'll do that. We'll depend on the professionals in our Public Health Department and our partnerships with schools, which are very strong and have gotten stronger during this pandemic, and we'll work together to address that question.
That's all we have today.
Okay, thank you.